Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPod Squad. The RadPod Squad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPod Squad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Let's move on to the anatomy and search pattern that we best identify in the coronal plane of the ankle, or consider the axial plane of the foot. And in this schematic, what we can see at the dorsal aspect, we're looking at the dorsal aspect of the fibula and the medial malleolus. We can appreciate the bands of the deep deltoid. We can appreciate some of the region of the syndesmosis. We can appreciate the posterior talofibular ligament and the calcaneofibular ligament and the cutaway of the peroneal tendons. We're going to be able to see the tendons, the ligaments, both the deltoid, spring, and calcaneofibular. We're going to be able to assess the talar dome, much like we see on an AP radiograph. The coronal imaging is very nicely demonstrates the talar dome. We'll be able to see the tarsal tunnel in coronal imaging, portions of the sinus tarsi, and of course the plantar fascia. And on these representative images, you can begin to understand that we can see a portion of the medial malleolus and some of the medial flexor tendons already, the posterior tibial, flexor digitorum, and flexor hallucis. We're seeing this ligament deep to the posterior tibial. That's your tibiospring, your superficial deltoid, moving towards the region of the navicula. That will be your spring ligament. We can appreciate the axial cross section through the region of the muscles of the heel, going from medial to lateral, abductor, abductor hallucis, abductor digiti minimi, and of course we have our flexor digitorum brevis and quadratus plantae. This is the region of the sinus tarsi, laterally pyramidal shape, which is wider than the medial pinhole. In the coronal plane, of course, we're going to be assessing our tendons, ligaments, bones, the tarsal tunnel, sinus tarsi, and plantar fascia. Let's move on to assessment of coronal imaging plane. In the coronal imaging plane, we can set ourselves up to understand the ankle mortise and its symmetry. That's where we can see the region of the anterior syndesmosis again. We can appreciate the interosseous ligament seen here and the posterior syndesmosis seen here. But we can see that the ankle mortise is symmetric. Moving from the medial to the lateral side on coronal imaging, we can appreciate our medial flexor tendons coming down the posterior tibial, flexor digitorum, and flexor hallucis longus tendons. We can see the nerve artery vein bundle between these regions. That's your posterior tibial nerve at your tarsal tunnel. In the coronal plane, moving to the lateral flexor tendons, we can appreciate our peroneus longus and brevis. We can see the inframalleolar peroneus brevis just distal to the calcaneofibular ligament. We can see the peroneus longus as it's going to move underneath the cuboid tunnel towards the base of the first metatarsal seen here. We can appreciate the region of the extensor tendons and even see coronally the region of the deep peroneal nerve, artery, and vein as it moves underneath the region of the superior extensor retinaculum. The power of the coronal imaging is probably best utilized when we're looking at the plantar musculature of the heel and the plantar fascia. So when we're looking at the central cord, we can see the central cord, the lateral cord, and the medial cord, and the muscles. Of course, the quadratus plantae, the flexor digitorum brevis, the abductor hallucis, and the abductor digiti minimi laterally. So there's an abductor laterally, an abductor hallucis medially, the flexor digitorum brevis centrally, and the quadratus plantae along the medial aspect of calcaneus. Coronally, we can appreciate the sustentacular talar shelf. This is your calcaneus, and this is your sustentaculum talus. And notice that it is relatively horizontal in this patient. And then as you move towards the region where we were suspecting there may be degenerative changes, we can see that there is some kind of subchondral change in this region of an extra-articular talocalcaneal facet seen in this location around here, and probably better seen on the sagittal sequences here. So moving back to our coronal imaging, what we can see best are the plantar fascial muscles, the central cord of the plantar fascia. We can appreciate the region of the sinus tarsi and how it is pyramid shaped and exits laterally to a wider window than medially. Coronally, we can truly appreciate best these deep deltoid ligaments. So you can see the deep deltoid here. Furthermore, we can appreciate the region of the tibiospring to supromedial band of spring ligament. It's slightly thicker in this patient. We can also appreciate the flexor retinaculum. That's going to be a band that attaches directly to the abductor hallucis. And we can take a look at this on our coronal T1s where we can appreciate those deep deltoid fibers with fat normally interdigitating between them. We can appreciate the region of the tibiospring as it attaches to the spring ligament. Moving back here, we can see there is no synovitis or fluid, and we can appreciate the flexor retinaculum superficial to our posterior tibial tendon. We see our medial deltoid ligament complex, our superficial deltoid and spring ligament. Let's move back to the coronal image and take a look at our lateral cladal ligament complex, the ATFL, seen here, to the PTFL. And of course, the ATFL has two bands, the superior band and the inferior band is going to blend with this arcuate ligaments towards that calcaneofibular ligament seen here. This is your calcaneofibular ligament moving from the calcaneus to the fibula. And there is a relationship in these arcuate fibers seen here as we can then attach to our ATFL. So the ATFL, calcaneofibular ligament, PTFL, posterior syndesmosis, interosseous ligament, anterior syndesmosis, several bands to the anterior syndesmosis seen here. Medial ankle ligaments, we can see the deep deltoid superficial, deltoid superficially towards the tibiospring, or if we move out towards anteriorly towards the navicula, we can sometimes appreciate the tibionavicula on the coronal image, and of course the tibiocalcaneal seen more posteriorly. And then of course we can see underneath the talar head the fibers of the inferior, medial plantar, and supromedial band of spring ligament holding our talar head. Furthermore, we can assess the bony structures by assessing osteochondral defects along the talar dome, which we can see very nicely on coronal imaging. We can see also any type of Roman arch dislocation or subluxation at the midfoot, and we can even appreciate whether or not there's any type of denervation or muscular strains seen either in the extensor digitorum brevis muscles or the plantar muscles up the heel. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.